We'll begin with Mr. Graham. You may begin when you're ready.
Thank you, sir. Chairman Buchanan, Ranking Member Lewis. My name is John R. Graham of the National Center for Policy Analysis. I'll take my short time today to emphasize some of the commentary I brought up in my written comments, which I've already submitted to you and which I drafted before President Trump issued his executive order, which I think makes the individual mandate of even more pressing concern. Will it be enforced by the next HHS secretary? If it's not enforced, will it cause Obamacare to collapse? Or perhaps some of us might say collapse more or faster than we've seen it collapsing already. Politically, it's very easy to go after the individual mandate. It is the least popular part of Obamacare. However, it counterbalances the most popular part of Obamacare, the protection against being underwritten for pre-existing conditions. I think my message today could be worry not. Although the individual mandate is bad politics, I would also assert it's bad economics, or at least weak economics. It is low-income people who are largely uninsured. They cannot bear to pay the fee or tax or penalty or whatever we want to call it for violating the mandate. So although it is appealing to conservatives to think that this imposes individual responsibility, in fact, what its real effect is to give cover to significant growth in government spending and government programs, which is fine in some people's minds, but not for conservative minds, I would suggest. Now, whatever we want to call it, the law, as you know, calls it a penalty. CMS, healthcare.gov now calls it a fee, but whatever we want to call it, it is inefficient in a very mechanical sense. A recent memo from the Internal Revenue Service points out that 6.5 million people paid the fine in 2015, but 12.7 million were exempted for various reasons. Again, emphasizing the point that most people whom you think you're affecting with a mandate cannot afford to pay it. How much was raised from the mandate? $3 billion. Now, to me, that sounds like a lot of money, but as you know, in the healthcare system, that's nothing. We spent $3.2 trillion on healthcare in this country.
Mr. Miller and Mr. Graham, I want to direct this to you. Isn't it true that the individual mandate was supposed to increase competition on the exchanges by ensuring that people sign up, thereby encouraging insurance carriers to offer more choices and broaden those networks?
That was the stated objective, and as you've described it, it's not been the case. And that's not going to turn around on its own. I think President Obama's Council of Economic Advisors, just before they left, asserted that the insurers have now got it figured out, everything's under control. The first 3 years, we had the training wheels on board, but now we're good to go. That doesn't make any sense. You know, last year, from 2016 to 2017, you had by far the worst premium increase, 25% nationwide average. It's not getting better, it's getting worse. It's like the insurers are having more and more trouble every year they stay in the exchange.
Well, I guess my follow-up is when insurance networks have become so narrow that individuals like my constituent, and there's many of those in Indiana, I just talked about one, when they lose access to their doctors, what does that say about the individual mandate's effectiveness to begin with?
I think it says you're on the route to Medicaid for everybody, where there's very poor access to care in many cases. So folks like, I know some of the members have given testimony from their constituents. The whole structure is so terrible. You know, you earn an income that's, you're not Medicaid eligible, so you can't even get the poor access to care that Medicaid offers. You might get some tax credit in the Obamacare. Maybe you make too much money for that. It's hard work to figure all that out, you know, and then the IRS comes after you next year and says you owe money back. So the complexity is far too complex, and I think when you go from one insurer to no insurer, as in Arizona, you were very lucky. I mean, what is a market where there is no insurance offered? Right. It's not a market.
Perhaps the solution is to raise the penalty and coerce more people into signing up for health insurance. I don't think that would be a very popular measure, and I assume most members of this committee and in this House would probably not be predisposed to supporting that kind of measure. What are some alternatives?
There is a certain population, if you're just going to say you've got to maintain continuous coverage, you've got to, or pay a fine or whatever, there is some level of the population that will not pay that. This is just a reality. They will, you know, when you lose your job, your mortgage payment or your rent comes first, and you're going to drop your health insurance premium. So there'll always be some population that has to, I hate to say be taken care of, but the social safety net. And I know on your side of the aisle, you've talked about high-risk pools, things like that. I would just like to point out that, Massachusetts had a reform that had some good things, some bad things. The gentleman from New York who's left, every state had all these tools at their disposal. So what I like to say is if we don't know the perfect answer, the magic bullet, let's let 50 states try and figure it out and learn from them.
So I guess what it comes down to, if we're talking about this, and if a big part of the individual mandate was going to cover the cost of all these things, the question is, did it work?
Very little of that has to do with the individual mandate. There's been some Medicare changes going on. Most of the effect of the Affordable Care Act in terms of coverage is Medicaid. And I know I'm going to provoke some folks here, but I don't like to include Medicaid as insurance because Medicaid is a welfare program. So as long as we include more Medicaid enrollment as insured, that's like saying more TANF or with having a job. It doesn't make any sense, So if we're going to be coherent about, are we giving people more welfare benefits? That's fine. If that's what y'all want to do, that's your prerogative as the folks who tax and spend. That's what you're going to do. But let's not pretend that we're making people more individually responsible through this mandate. And as you say, for very many people, the small business owner, the self-employed person, it's just driving them crazy, as we've heard from you and so many of your colleagues, trying to figure out what the heck's going on, how to get an affordable plan. And
What are we going to do about your thoughts in bending the curve? It's just, and I know it's a big discussion, but I'd like to just have maybe 30 seconds each of you just to give me your point.
yeah, I would agree with Mr. Miller, and I would point out that all this money going into the Obamacare exchanges, it really goes to insurance companies. We advocate consumer-driven health care. We don't give any tax credits to individuals that they can spend directly. And I know one of the members talked about the premium is more than the rent. Well, when I pay my rent, I move in that day and I start living there. I pay for these insurance policies and they don't kick in until I go to the hospital. So if we're going to help people, let's help them pay directly for care. And we have some good experience that can help reduce costs.
I'd like to thank our witnesses for appearing before us today. Please be advised that members